Hi, this is Karen Gedney. I'm your friendly prison doctor. I have a couple of thoughts today on a topic that may interest some of you. And that topic is addiction and prisons. There's a lot of conversation going on now, certainly about decriminalization of drugs. Should they be legal? What should happen with individuals who use drugs? Do prisons work? I can say that after 30 years of prison, I have pondered those questions myself. I will also admit that when I started as a prison doctor 30 years ago, I had no concept about prisons, and I will also admit I had really no concepts about addiction. Was I taught substance abuse and drug addiction in medical school? Basically, no. In residency, what did I really know? Well, I can imagine that if you know any intern or resident, they will talk about their experience in emergency rooms where people who were high and drunk would come in and tear up the place. But in terms of training, that really lacked, and especially lacked in the area of why does it happen? Why do people become abused? And why do some people stop what they're doing once they suffer the consequences? So let me share a couple of things with you today that I've learned. I really learned that humans, all humans, they seek two basic things. One, they want to access pleasure, and they want to avoid pain. Some individuals do it with different tools, different tactics, different training, different cultural, let's say, impact, different options. I've always been a bit interested in why an individual who's poor, who has pain and who has issues and resorts to a chemical that is cheaper for them and easily accessible, whether it is alcohol or nicotine to cope, is different than an individual who has money and goes to a physician and gets an upper or an antidepressant or whatever they may get. I think that that type of discussion is usually not talked about that much. Also, what's not really talked about is the medicalization of, let's say, life in dealing with moods that drug companies, Big Pharma, basically pushes on doctors. This mindset that if you have moods that swing up and down, if you're depressed, if you're anxious, one, there's got to be a reason in the brain. Let's find the right drug and let's give it. I think, and I've always been affected by the hypocrisy of that approach, where one particular set can end up in prison and the other can appear, let's say, in books and in magazines extolling how certain pharmaceutical drugs help them with their depressions and moods. Now, I in no way want to presume that I have any answers to some of these questions. I would encourage you to think about, does our approach to substance abuse, drugs, actually make sense? Does it make sense to take an individual who's trying to cope with life, has poor coping skills, maybe mental issues, or let's say training issues, experience issues, that they use chemicals to change their mood, they go to prison, and then they get disconnected, disenfranchised more. When they leave, it's even harder for them, and that they get looked down upon as failures, weak, that sort of thing. I remember some of my custody staff over the years would make disparaging comments. Well, that meth addict did it to himself. And I'm looking at an officer who may be 100 pounds overweight, who's a smoker, but he would never think that his diabetes and gout is related to his lifestyle. And with that sort of perspective, I'm going to end this little video, and in the future I'll be talking more specifically about some of my thoughts on addiction. Until then, I wish you health, happiness, and more than anything, I wish you the ability to ask questions.